In November of 2017, a special legislative session totaled almost $121 million in Montana state spending. The cuts were necessary due to lower than expected state revenue and a budget-breaking fire.
Now, the cuts are touching virtually every part of state government and general public health and human services. The cuts are deeper than many. The agency lost $110 million, based on MontanaBudget.org. It comes in a time when mental health and substance abuse treatment are front and center in the public conversation about firearms, drug abuse and homelessness. One service hard hit is the Western Montana Mental Health Center. Right now, they're struggling with a 10% cut.
So far the state cut $4 million of the $41 million annual budget at the Western Montana Mental Health Center, leaving patients and centers vulnerable.
Officials at the Western Montana Mental Health Center are working to figure out how to provide the service on a tighter budget, meaning layoffs and cutting some services.
Adult and adolescent and children case management services have been cut, almost completely. Other programs for adolescents like Home Support Services, Program Manager for Outpatient Services Logan Cook said. Officials said 5,000 patients were affected by these cuts.
Director at Western Montana Mental Health Center, Mary Windecker, says although many public health and social services were affected throughout Montana, the center's main goal is treating everyone in need.
We have to figure out new ways to treat people, so, more and more we are trying to be innovative, creative and come up with solutions to some of these problems, Windecker said.
The agency serves 15,000 people across 15 counties.
The Missoula Center is one of 4 community-based mental health centers in Montana.
They're charged with serving people in the community with mental health disorders and substance use disorders.
These are people we formed a relationship with over decades, and now to see them suffering is very difficult, I think, for all of our providers, Windecker said.
The cuts went into effect January 1st.
3 months later, administrators are still waiting to see if the cutting is finished or if deeper cuts will be made. The final answer is expected by May 1st.
We were told only 5% of clients have private insurance while most are on Medicaid.